Prostate is a walnut-sized gland located between the bladder and the penis of men, anterior to the rectum. It wraps around the urethra and covers it circumferentially. It secretes an alkaline fluid, which makes up 30% of the total volume of semen. This fluid contains calcium, citrate, phosphate, clotting enzymes, and profibrinolysin. This fluid provides nutrition to sperms, neutralizes the acidity in the seminal fluid and the vagina, provides lubrication, and helps form a weak fibrin coagulum that holds the semen in the deeper regions of the vagina, enhancing the potential of fertilization. 3 major diseases that affect the prostate are prostatitis, benign prostatic hyperplasia, and prostate cancer. Prostatitis is inflammation of the prostate gland. It can be acute or chronic. Acute prostatitis occurs usually due to bacterial infections. Common responsible organisms in young adults are chlamydia trachomatis and Neisseria gonorrhea. And in older individuals, E. coli and Pseudomonas are more common. People with acute prostatitis frequently have nonspecific symptoms such as fever and chills, malaise, joint and muscle pain, lower back pain, and lower abdominal pain. Less frequently, people may also have urethral discharge. In addition, these individuals will have dysuria or painful urination and obstructive urinary symptoms such as urinary frequency and urgency, incomplete voiding, difficulty in initiating and stopping urination, which is known as hesitancy, nocturia or increased urination during night, which wakes the person up from sleep, and poor urine stream. However, it is important to note that obstructive symptoms occur only if the infection is severe enough to cause a blockage in the prostatic urethra. On digital rectal examination, where a healthcare person puts his finger into the rectum and palpates the prostate anteriorly, it may be warm, boggy, and tender to touch. Chronic prostatitis may be caused by infections, nerve problems, or chemical irritants. Unlike an acute prostatitis, person may be completely asymptomatic, and fever is not seen. On digital rectal examination, the prostate may be normal and it is not tender to touch. Benign prostatic hyperplasia, or BPH, is a common condition among older men. It is characterized by increased number of cells in the prostate. It is a completely benign condition and is not associated with an increased risk of prostate cancer. With progression of the disease, multiple hyperplastic nodules develop around the prostate, leading to compression on the prostatic urethra, which impairs the flow of urine. This will cause weak, inconsistent stream of urine, known as dribbling. In addition, person may also have dysuria, sense of incomplete voiding, and other obstructive urinary symptoms mentioned before. Bladder outflow obstruction causes stagnation of urine in the bladder, leading to urinary tract infections. On digital rectal examination, the prostate is symmetrically enlarged, has a smooth surface, firm to touch, and non-tender. Prostate cancer commonly occurs in the posterior zone of the prostate, which is distant from the prostatic urethra. Thus, the tumors can grow large before they cause urinary symptoms. When large enough, they cause dysuria and other obstructive urinary symptoms. In addition, person may have bleeding or blood-stained urine. If the cancer is metastasized, the commonest sites of secondaries are the pelvis and the spine. So, the patient will have pelvic pain and back pain respectively. The pain is worse at night and is not relieved by rest or position changes. Finally, on digital rectal examination of the prostate, there will be an irregular, hard lump felt.